Media Matters put together a video on the way Fox handled the COVID-19 pandemic, and it's pretty devastating.
States that never locked down at all, states where people were allowed to live like Americans and not cower indoors alone, in the end turned out no worse than states that had mandatory quarantines.
As you look at all the data all around the world where people have come out of lockdown, things are actually going along quite nicely on the whole.
There's a lot of studies coming out that question the validity that social distancing and mass quarantines will slow down the virus. At least it's debatable.
There is still no science or data at all after 2 months that these lockdowns have done very much to halt the spread of this virus. Sorry.
Does it work? Yeah, we're seeing in China, in South Korea, elsewhere, these kind of efforts make a difference, and we're seeing a slowing of new cases. So yes, it matters.
The science behind the 6 feet is completely sloppy and what I would call lame.
Social distancing doesn't work, quarantining doesn't work, masks don't work.
So certainly we have seen a plateau, a decrease in the numbers from China and South Korea. That's encouraging. It tells us that if you follow these measures, now granted those were aggressive and they had more testing, you can slow it.
And by the way, there's not a lot of evidence that masks would help.
There is zero science for having children wear masks.
Now, we've already showed you how the science behind the mask mandates is shaky.
But we don't actually have the studies to prove how effective it is.
These images show the airflow when someone breathes or coughs without a mask, and this is the airflow with a mask. Research already showing masks can work, like this study, which found mandatory mask wearing in 15 states in Washington, D.C., possibly averted up to 450,000 COVID cases.
From a medical and a common sense standpoint, the decision to put kids back in school should be a slam dunk yes.
We need the schools to open. The risks will be very low in New York.
Children, for some reason, are at very low risk of coronavirus and are at very low risk of transmitting the coronavirus.
Teaching is a young profession. They have almost zero risk from this.
Opening up the colleges and opening up the schools is a totally fine thing to do. Young people are not dying from this virus.
Children are not meaningful vectors for the coronavirus. Worldwide, there is not a single recorded case of a student infecting a teacher with the virus. Not one case.
A CDC study identifying 12 children thought to have been infected at child care centers who went on to infect 12 others, including parents and siblings.
Hydroxychloroquine in the laboratory looks like it does have some effects against COVID-19.
Some recent studies are showing the positive effects of hydroxychloroquine.
Hydroxyhysteria has been around for decades. And it's something really the FDA should have stayed away from.
There's a cure, there's treatment for early COVID disease, and that's hydroxychloroquine and zinc. It's very straightforward.
I know of no evidence base to suggest that hydroxychloroquine would be good for the prevention of COVID virus infection.
In fact, lockdowns and mandatory mask mandates are probably slowing the onset of herd immunity.
We might reach herd immunity at much lower rates of infection than the 50 to 70% that people have speculated.
Vaccination creates artificial herd immunity. It looks like natural herd immunity is already developing.
Denying herd immunity is like denying gravity. Gravity exists and herd immunity exists.
Herd immunity is a terrible strategy, and I know that there are people who continue to advocate for it. And let me just first make the case for why it's a terrible strategy. To get to that, for this virus, we think you're going to need to get 60-70% of the population infected. So it would be 10x number of people infected of what we have right now, and 130,000 people have died. So if you do a 10x on mortality, that's 1.3 million deaths. Even if you say, well, it won't be that bad and we're going to get better on treatment, it'll still be many, many, many hundreds of thousands of people dying and many, many millions of people getting very, very sick.
Now we know more about this virus. Extremely low lethality or otherwise healthy younger Americans, they do pretty well.
We want people who are generally healthy to actually contract COVID if they do naturally.
For people aged 1 year to 69 years, the survival rate post-infection with COVID is over 99%.
If you get it, there's a very good chance, almost a guaranteed chance, if you look at those numbers again, around 100%, that you will survive.
We do know that some people will have long-term negative impacts on their brain in terms of neurological changes like impaired taste, impaired smell, impaired concentration. And some people will end up having disorders like depression and PTSD, post-traumatic stress disorder. If you're not making a quick recovery, start to seek help.
watching that, I'm not confused as to why it's been a disaster in the United States and we're faring much worse than the overwhelming majority of other developed countries. I mean, that's like, our media has just failed us. And for the record, it's actually not just the media, because even our own government and even Fauci, who's really deified now, he said at one point, masks don't work. He said that. He said, don't get masks. And the reason he was saying that is because he thought there was going to be a shortage and he wanted to make sure the frontline workers had them. But instead of being honest and saying that, he was like, no, masks don't work. There's no evidence of that. I remember that. And that's devastating because he undermined his own credibility. He should have just told the truth. But like you see here, between that and looking at the way the media has talked about this, man, it's really unacceptable. It's really unacceptable. You have to be as responsible as possible while talking about this stuff. You have to be concrete. You can't just wildly speculate about stuff. The evidence on a bunch of things is clear, and the evidence on a lot of other stuff is murky. But you got to tell people that, When you look at the rest of the world and who fared best, we do have clear answers, man. We do. I mean, putting aside the freedom and liberty questions in regards to economic shutdowns, putting that aside, yeah, there are a lot of countries that really had aggressive shutdowns and fared way better than us. So again, to say nothing about the political question and nothing about the freedom and liberty question, empirically speaking, are there more benefits health-wise if you do that? Of course, there's no denying that. There's no getting around that. Just like there's no getting around that masks work. There's no getting around that. They're not perfect, but they work a hell of a lot more than if you're not wearing them. So, but you see all this misinformation. How many times with the bogus cures and the herd immunity question, and what was it? I think Sweden originally tried to do herd immunity, and their death rate was way higher than everywhere else in Scandinavia. So I found it so weird that a lot of people on the right were talking about that as like their go-to example of the way to handle this, but their death rate was higher than the rest of Scandinavia, who locked down. And I think Sweden actually gave up on the herd immunity thing. So we got to be humble in the face of a pandemic. And I do think you should listen to the experts. But then when Fauci goes out there and says something that turns out not to be true and was a lie, then you undermine all the expertise. And the sad fact is, guys, I feel like in so many ways, psychologically and mentally and politically, we're in the same place or even a worse place than we were back in 1918 when you had the Spanish flu pandemic. That's what it feels like, We had the science and technological ability to create the vaccine in record time with over 90% effectiveness for some of these vaccines, but we didn't have the political ability to distribute it without a hitch. We're distributing it terribly, and we're lagging way behind. That says a lot, man. That and how terrible our public discourse is says a lot. It's really sad, and it should slap you in the face and make you recognize there are no adults in the room. When you're a kid, you look at the adults and you think they relatively got stuff figured out. They're just children in adult bodies, and I think this makes that clear.